Hello and welcome. I would like to offer my personal message to our friends and supporters out there and those that we support. And we would like to wish you all the very best and hope that you are staying safe during these challenging times. Whilst COVID-19 is already at the forefront of our public health professionals' attention, fetal alcohol spectrum disorder remains an important issue and presents its own unique challenges. We know that those most at risk of COVID-19 are people with underlying health conditions and the elderly. This crisis is especially difficult for children and adults with FASD because they can have a high rate of pre-existing health conditions, low levels of health literacy, and they rely on others to access the care. Many individuals with FASD rely on caregivers and others for support. Social distancing has necessitated the separation of people from their support providers, and many crucial support services have closed completely during this crisis. Virtual communication can be especially difficult for people with FASD, given that they often struggle to read social cues in face-to-face social interaction. Now much more difficult with the limitations of virtual communication. Many children living with FASD rely on their school's special educational program. With most schools closed for the duration of this crisis, these supportive services have been dramatically reduced or are just unavailable for them. FASD awareness's number one priority are our service users. And as we are unable to provide our usual physical support, we are implementing ways to provide support virtually so that our families do not feel any more isolated at a time where they are already feeling lonely, isolated, and worried. The coronavirus pandemic is exacerbating an already difficult time for our families, and we recognise that the effects are likely to be long-term. We will be reaching out to all our service users to ascertain their needs and provide various solutions to reduce isolation. This will be a completely new project created as a direct result of the pandemic and includes online support groups, regular contact by buddying, and access to trained mentors. We will also be actively undertaking a social media campaign to highlight the effects of drinking alcohol whilst pregnant. In times of crisis and psychological distress, the rate of harmful alcohol consumption increases, as can the birth rate after periods of social isolation. Together, extended seclusion and stress could mean more pregnancies exposed to more harmful alcohol consumption patterns. We want to assure you that we are still working and able to accept new registrations. Our telephone line is still open and we are responding to emails. In terms of fundraising, we are 100% reliant upon grants and community and corporate generosity to sustain the costs of the services we provide, as well as our running costs, and therefore appreciate each and every one of you who still plan to support us in these difficult months that lie ahead. It goes without saying that the balance of income against the provisions of the support services we are planning to roll out through these difficult months is modest. So if you are able to continue to support us, it would mean such a great deal. Any donations are welcome at this time, and if you're able to commit on a continual basis, why not set up a small monthly direct debit payment? This can be done either online through the Just Giving platform or as a standing order directly into the charity's bank accounts. Further details can be found via our website. Alternatively, join our Million Steps Challenge and raise money for FASD awareness. Feel good and do good as you walk 1 million steps and help raise us some funds to support the vital work that we are doing in our communities. It just leaves me with a message to say a huge thank you for your continued support. We really couldn't be doing this and helping those in the communities that need us the most without your financial support. So a huge thank you to you for that. And I'd like to just personally say, please stay safe and healthy. And we look forward to seeing you either virtually or at a safe distance in the coming months. All the very best. Stay safe.